Thank you so much. I really appreciate your valuable insights this morning. As chairman of the Health Subcommittee, I think this is a very good place to start, but recognize that we need a more in-depth exploration across the board of healthcare disparities that affect people in all conditions and in all ages and in both genders. I think it's particularly important that we look at the reforms that have been outlined in legislation that was filed last session, the Health Equity and Accountability Act by Mr. Lewis, Ms. Sanchez, Ms. Sewell from this committee, Ms. Chu, Representative Davis, Gomez, and Blumenauer from this committee. There's much more work to do here about the broader issue of healthcare disparities. In Texas, your zip code is such a strong predictor of the health of mother and child. In San Antonio, Bexar County, which I represent, the disparities are really stark. Overall, Bexar County has the highest infant mortality rate in the state, and the greater San Antonio region has the second highest maternal mortality rate. And almost 40% of the live births involve women who did not receive any prenatal care or received it only very late in their pregnancy. The numbers show why giving the state of Texas more responsibility by block granting Medicaid would be such a terrible mistake, and the harm that has already been caused by the state's failure to accept available federal funds to expand Medicaid, as well as its continued outrageous attacks on Planned Parenthood. Even for those Texas women who receive Medicaid coverage during pregnancy, coverage, as Dr. Ollier pointed out, it has been terminated at 60 days after childbirth under the state's very stingy Medicaid program. I'm pleased with your testimony, Doctor, and the work that's being done in the Texas legislature now to try to extend that 60-day period to a more reasonable level. But overall, while it's very important to work on the data, and I want to inquire more about that, we need not only good data, but we need good care, and we need it for all economically disadvantaged Texans, and particularly to address this issue of disparities. Bringing a child into the world is, of course, a combination of joy and stress, but that stress is enhanced when the women who travel through our healthcare system don't see many medical professionals that look like them. And so we need to work on our workforce in the healthcare system as well as one way of addressing this matter. In San Antonio, our nurse Veronica Haywood and a group called Latch Support is one of those groups that is working to address this whole issue and to empower moms and break through some of the cultural barriers. The San Antonio Express is editorialized a number of times about data problems because we had a declaration that Texas had the highest maternal mortality rate in the world, but it turned out that the data had been inflated, and that entire process really interfered with our ability to get at this problem. There are so many other groups that are in coalition in Bexar County working to try to address this problem, but I want to ask, I guess, Dr. Robinson and Dr. Harris, given your comments about institutional racism, about what else we need to do to get the care there to help address this problem.
Thank you so much for that question, Mr. Doggett. So I think I would start by saying that training providers on what systematic or systemic and institutional racism is the first step. So often we talk about race or racism in this country, it's about a personal attack. And I think when we think about systemic racism, there are very few people who would argue that any policy that's geared toward keeping a group of people down needs to stay in existence. And so sometimes those are things that we just don't know about, and when we have training and can understand that there are things that have been in place for generations that we can all work together, we can work across states, across aisles, to to address once we know what they are. I think that's the first piece of it. We can think about providers at the hospital and health system level, which is important, but then as Ms. Felix and some of the other panelists have said, talking about some of our community organizations. So when we think about nurse midwives and we think about doulas, making sure that people can get care where they are, that there's coverage for that, because those services are not cheap and they're not currently covered by insurance. And then when patients understand that piece of it and understand how to access services and are met with a health system that supports them and understands how institutional racism plays a role, there's a better chance that we can work to eliminate maternal mortality.
Thank you very much. And because I see our time is up, we welcome additional written submissions from any of the witnesses on these issues.